Hi everyone, hope you're having a good week. My name is Veronica, and this is my discussion post explaining the role of B and T cells as well as the issues associated with their deficiencies. B cells are a type of white blood cell, specifically lymphocytes, that makes infection-fighting proteins called antibodies. B cells are an important part of the immune system and are critical to the body's defense against pathogens. B cells make antibodies in response to antigens. Antigens are markers that allow the immune system to identify substances in the body, including harmful ones such as viruses and bacteria. There are two main types of B cells, plasma cells and memory cells. Plasma cells release antibodies in response to antigens. Once a B cell becomes a mature plasma cell, it can release up to 2,000 antibodies per second. It's important to note that they have a shorter lifespan than memory cells. Memory cells are able to remember particular antigens, so that if they appear in the body in the future, the immune system can quickly go on the defensive. While plasma cells fight bodily invaders by producing antibodies, memory cells help your immune system fight in the future due to the exposure of the immune system to that antigen that the memory cell is able to remember. That way, if the invader appears again in the future, the body can quickly mount the attack. T cells are another type of lymphocyte. T cells protect you by destroying harmful pathogens and by sending signals that help control the immune system's response to those threats. T cells are critical to the immune system as they send signals that help control the immune system's response. There are two main types of T cells. The first is cytotoxic T cells. Cytotoxic T cells kill cells infected with viruses and bacteria, and they also destroy tumor cells. The second type is helper T cells. Unlike cytotoxic T cells, helper T cells don't kill cells directly. Instead, they send signals that tell other cells how to coordinate and attack against pathogens. Helper T cells signal cytotoxic T cells, B cells, and macrophages, which are another type of white blood cell. Unfortunately, there are immunodeficiencies associated with defects in the components of the third line of defense, or adaptive immunity, which involves B and T cells. Since B cells are the cells responsible for the formation of antibodies, patients who have B cell deficiencies often have lower levels of antibodies or lower levels of functioning antibodies. Humoral immunity is the process of adaptive immunity manifested by the production of antibodies by B cells, which develop in the bone marrow and are manifested in extracellular fluids. Since bacteria are mostly extracellular organisms, people with B cell deficiencies will be more susceptible to bacterial infection. Conversely, T cells are critical in cell-mediated immunity. This is an immune response that does not rely on the production of antibodies, but rather on the activation of phagocytes, antigen-specific cytotoxic T cells, and the release of various cytokines in response to an antigen. Since viruses are intracellular, people with T cell deficiencies are more susceptible to those viral infections. Unfortunately, some children fail to develop any lymphoid stem cells at all, and as a result, they produce neither B cells or T cells and cannot mount immune responses. The resulting defects in the immune system cause severe combined immunodeficiency disease, or SCID. Other children can suffer just from T cell deficiencies alone. For example, DiGeorge syndrome results from a failure of the thymus to develop, which means there are no T cells. Individuals with DiGeorge syndrome generally die of viral infections while remaining resistant to most bacteria. Luckily, doctors can treat DiGeorge syndrome with a thymic stem cell transplant. The most severe of B cell deficiencies is called Bruton type agammaglobulinemia, which is an inherited disease in which affected babies, which are typically boys, cannot make immunoglobulins. These children experience recurrent and overwhelming bacterial infections.